This episode of the Senior Rehab Podcast is sponsored by the Academy of Geriatric Physical Therapy. AGPT's mission is to further your ability to provide best practice physical therapy and to advocate for optimal aging. Falls are a big deal with our patient population, but do you find yourself struggling to manage or even prevent falls with your patients? You should check out AGPT's clinical guidance statement on the management of falls in community-dwelling older adults. This paper gives you a clear direction, recommendations, and action steps so you can help your patients. You can get this article for free and learn about how the AGPT can further your clinical practice at geriatricspt.org/SRP. Hit me!
This is a Senior Rehab Podcast, the podcast for rehab clinicians that want to better serve older adults.
Hey there, Senior Rehab Podcast listeners. I'm Tali.
I'm Erinn Carey.
And this is SRP Rex. How are you doing, Erinn?
I'm great. Tali, how are you?
I'm good. Are you more of a winter person or a summer person?
Definitely winter. I would so much rather be wearing a coat and a scarf and snuggling up with like wool socks and pajamas than sweating.
Yeah, sounds fair. I'm also more of a winter person. I hate the summer. Like, I love some parts of it, like a good watermelon or ice cream, but ice cream you can get in any.
I like a nice wheat beer on a warm summer day.
The temperature is not my favorite thing. So today I want to talk about a study that described the association between indoor temperature and physical performance in older adults. Every season has its hazards when it comes to older adults.
Mm-hmm. Like heat stroke.
Heat strokes, or in the winter, if it's slippery and people fall because of snow or melted and reformed ice.
Yeah, that's a good point.
Or hypothermia. Now we're going to talk about heat, just because it's getting a little too hot, and I thought...
at least on this side of the globe, yes.
Yeah, we do have listeners from the other side of the globe. But
enjoy your winter. Just know that we're jealous.
Yeah. Because excess outdoor temperature in the summer has resulted in an increased mortality and also morbidity during heat waves, especially among vulnerable populations like older adults and small children.
Yeah, I'm not surprised by that at all.
For example, in Europe, I don't know if you remember, in 2003, there was a heat wave that had about 35,000 deaths related to that heat wave.
Wait, what?
In 2003, yeah, it was the highest temperature recorded since the 1600s.
Wow. I know, I don't remember that at all.
A lot of people died, especially older adults.
Wow, okay.
Yeah.
That's scary.
Yeah, and especially in France, because air conditioning is not a common thing there in houses.
I cannot imagine life without air conditioning. That's the most first world problem thing I've said today.
But understanding the association between temperature and relevant parameters in physical activity can help us make recommendation on how to adapt healthcare and or behavioral strategies at times of heat stress. Because older adults are a population that spends a lot of time indoors, indoor temperature is even more relevant than the outdoor temperature.
I see.
Yeah, with regard to that mortality.
Got it. It just makes me think of, so my grandmother lives in Florida and she doesn't run the AC.
Yeah, because the indoor affects more about, in that population, more about the physiological parameters like blood pressure, heart rate.
I mean, it is in everyone though.
It is in everyone, but with that population...
It's more?
It's more, again, because thermoregulation goes down as we age.
Got it.
And now I'm explaining why they're doing the research the way they're doing it.
Okay.
Most of the information we have about indoor heat on physical function is from the lab. It's not from people in their own house.
Yeah, that can only give us so much information.
Yeah, and although it's more accurate, the laboratory, it's not where people live unless they are doing their PhDs.
Shout out to all the PhD students currently in laboratories.
Yeah, sorry guys, but at least you have the AC on.
Yeah, I was just thinking that.
And another thing, when maximum performance is not necessary, a voluntary reduction in physical performance can be expected.
Sure. Due
to the thermoregulatory behavior, but when maximum performance is tested, a reduced performance can be attributed to stress heat.
Yeah, I mean, so I know that when it's really hot, when I'm really hot, I don't want to do anything, and I feel sluggish, and I feel like I don't have the energy to do things.
Yeah. So we're basically kind of like solidifying and putting in a more professional way the sluggish. We're
measuring slug.
We're not measuring slug specifically, though I would love to, but in this one, we're validating the sluggish.
It's better than me just saying I'm sluggish. I am sluggish because of this mechanism. This demonstrates the sluggishness.
Exactly. And with regard to maximum physical performance, a negative effect of high ambient temperature on endurance capacity is documented mostly in young athletes and older women in the lab. So heat is not good for endurance.
Right.
That's what we're trying to say.
And we have some evidence that supports that in those populations.
Yeah. But there's an improvement in short duration exercise performance when it comes to moderate increase in muscle temperature.
Like when the muscle is a little warmed up, it
exactly.
performs better. Yeah. Oh, yeah. Definitely.
Exactly. Because it increases all the chemical reaction, the nerve conduction, contractibility. So this is good for performance, but it's also...
If it's too much, it's not good.
Not only about too much, it affects two contributors in our body for performance in two different ways. About endurance, it makes it worse, and about the muscle, it actually makes it perform better.
I see. Okay.
Yeah. And little is known about the effect of heat on physical performance in daily life.
The sluggishness that we were talking about.
Not only the sluggishness, how it affects standing up from a chair, how it affects regular walking, how it affects ADLs.
So the research has pretty much just been done on athletes of varying ages and not like people living their daily lives.
And also adults, but about walking, about running, about things like that, not about sit to stand.
Got it. Those functional activities that we love so much.
Yeah. The aim of this study was to describe the association between indoor temperature and physical performance in the home environment of older adults during the summer of 2015, which was one of the hottest ever in Germany, and had two heat waves, one in July and one in August. And I have to say, although there are some flaws, they are very aware of those flaws. So, materials and methods. Subject and design, it was a convenient sample of independent older adults that was recruited from 10 facilities of sheltered living in the city of Stuttgart, which is one of the warmest regions in Germany. The inclusion criteria. You had to be age 60 and older, no need of formal or informal support, which means you don't need help with your ADL with either a family member or somebody professional that comes. You can use a DME or cane or anything.
So no home attendant and no family that takes care of your IADLs.
Yeah. And regular outdoor activity of at least 30 minutes a day. So it's not homebound.
Wow. So they're pretty active people.
Yeah. Exclusion criteria. Not being able to follow instructions, uncontrolled cardiac illness, use of wheelchair or terminal illness.
Those are some pretty specific exclusion criteria, so they were pretty broad with who they included. Like no past stroke, only uncontrolled cardiac stuff. So like if they have hypertension that's under control.
Yeah.
Or like a cabbage or something.
Yeah. Which I kind of like when you include only healthy older adults. To be fair, unfortunately, it's not most of the population of older adults.
Especially not in this country.
Yeah. But this
doesn't
is
address
Germany.
multimorbidity.
The assessment protocol. The participants were visited every 4 weeks between May 2015 and ending in October 2015.
So once a month, someone popped by. And
in addition, there were 2 assessments when there was a heat wave.
Ooh, like 2 per month?
No, like whenever there were 2 heat waves. So it was one in July and one in August. Mm-hmm. During those heat waves, there was an additional assessment.
What did this assessment consist of?
I will say later, but I want to describe first what is a heat wave.
Okay.
It's defined as 3 or more consecutive days with a maximum outdoor temperature of 30 degrees Celsius, which is around 86 Fahrenheit or more, and with a heat alarm from German meteorological services.
So that they take into account humidity and things like that as
well?
Yes,
exactly. Because humidity, as we know, is very important when it comes to those things.
True.
Yeah, because it impairs the ability to dissipate heat. So it was a maximum of 8 assessments, right? Like once every 4 weeks, and in additional, the assessment was always between 8 a.m. and 3 p.m. and it was about 30 minutes for an assessment.
During the heat wave, did they try and go during the hottest times of day or anything like that?
No, because they tried, so they couldn't do it, so they will be like with Mr. S, always to go at 8:30. It's a little too much to do it for 81 people that are participating.
True, especially since they're home visits.
Yeah, so they at least did it between 8 a.m. and 3 p.m., which are the hot times of day. So the climate condition, which is the indoor temperature and humidity, they measured during each visit with a data logger that was placed on the table.
Just during the visit, not like during the rest of the time?
No, during the visit. What is the temperature while I'm assessing you? Physical performance, what did they measure?
Probably sit to stand, right?
They studied balance.
How'd they measure balance?
The balance was tested during unsupported standing for 10 seconds in consecutively more challenging positions if possible.
So like feet together, tandem, single leg stance?
Yes, only to avoid the ceiling effect and a floor effect, they added open stance.
Nice.
Yeah.
Oh, I should start doing that at work.
Yeah.
Because they're like, people can't even get into the Romberg position. And I'm like, cool.
Yeah.
Yeah.
Exactly. So they added open stance and then one leg stance. Yeah. And each of them with eyes open. They didn't do eyes closed. Okay. So you had open stance, closed stance, semi-tandem, tandem, and one leg. So it was maximum of 50 seconds total if they got to the end.
So it was one right after another consecutively.
Yeah.
Wow. All right.
That's why I use the word consecutively.
Look at you. Do they have like a training session or?
I don't know.
Yeah. All right. That's okay.
All right. It's called timed 5 chair rise test.
Okay.
And the participants were instructed to stand up and sit down 5 times as fast as they can without using the armrests.
All right. So it's pretty much our 5 times sit to stand.
It is. That's what it is.
Okay.
It's 5 times sit to stand. Also, habitual gait speed was measured over a distance of 4 meters. And if needed, assistive device could be used. A little bit about the descriptive measures, because I found them interesting. Besides the age, body mass, and body height, and calculated BMI, they also assessed comorbidity with the asking for 18 age-relevant diseases with the yes or no. The worst score would be 18, the best score would be 0. At first, they created subgroups by frailty.
Which scale did they use to measure the frailty?
So this is my shout out to our series about frailty. They used the Freed.
Freed!
Yeah.
Beautiful. And shout out to Christina Previtt.
Yeah. Hi, Christina. Remember 5 criteria: gait speed, hand grip, strength, weight loss, exhaustion, and physical activity. Just go back and see how it scored. I really recommend that episode, but I'm biased. Pre-frailty was present if 1 or 2 criteria were fulfilled. Mm-hmm. Frailty was if it's 3 and up.
Yep. Pretty standard. I like it.
But since 11 participants, which were 13.6%, were defined as frail according to the criteria, with most participants categorized as pre-frail, 52, which was 64.2%.
Goodness.
Or not frail, which was 22.2%, 18 people.
I'm surprised with that, considering how active these people are.
That's why pre-frail is such a slippery slope, because people can seem fine.
Oh, object lesson of the day. Mm-hmm. I like it.
So they moved to categorizing more about low gait speed.
More like quality or?
No, just like the low gait speed.
All right.
Would be like another way to... So now they have 2 groups. They have older adults with high gait speed and older adults with low gait speed.
I like it. A nice simple stratification.
Yes. Instead of, just 11 of you were frail, and the most are either pre-frail or not frail, it's a better way to put it so we will have information that is necessary for us.
I like it.
You had 35 adults initially in the lower gait speed and 46 adults initially in the higher gait speed.
So pretty nice split. Okay.
Yeah. And cognition was screened by the short orientation memory concentration test. Pretty basic memory and orientation test.
All right. Cool.
Okay. Results.
I'm ready.
Yes. So we had 81 older adults with a mean age of 80.9, which is almost 81.
81 adults, 81 mean.
Yes.
Ooh, I like
yes, that's what I'm like.
perfect.
It's like so German not to put 81, but you put 80.9.
it.
Also because it's research and you need to say the truth and not what is convenient or pretty.
Even though it's cute.
Yeah. Most of them were women, 85%.
Wow.
Yeah.
Not surprising.
No. Also, remember it's a convenience sample.
Truth.
And a total of 538 visits were assessed, so the mean was 6.6 visits per person. The minimum indoor temperature that was measured during the visits was 17.2, which is around 63 Fahrenheit.
I mean, that's how cold I keep my apartment.
Yeah, that's true.
Yeah.
I did too. It was in October 14. The maximum indoor temperature was 30.3, which is 87, I think, Fahrenheit. And it was in July 7th.
87 indoor.
Yeah. That's hot.
Why?
Oh, and also they mentioned that there were 7 times when they have missing temperature values because the device didn't work.
Are you kidding me? How come they didn't get a device that works?
7 out of 538 is pretty impressive.
My watch tells me the temperature every day.
Yes, but not accurately. Participants with initially lower gait speed reported higher number of disease and symptoms, 5.18 versus 3.39.
Not surprising.
Yeah, it's really not surprising. And higher number of drugs being used.
Well, if you have more conditions, you're gonna likely take more medications.
Exactly. It was but this was like astonishing how much. It was 6.11 versus 3.89. Who do you think?
The people with the higher gait speed, ooh, maybe backwards. People with a higher baseline gait speed did worse in the heat than the people with the lower baseline gait speed. Just because I'm feeling sassy.
Okay, so you feel sassy. You're not wrong, but you're not right.
Hurrah! How do I feel?
I cannot tell you how you feel. You can only tell yourself. So there was a negative association between temperature and habitual gait speed with the total group, like all older adults, and also within the subgroup of older adults with initially higher gait speed.
So, wait, negative association, like increase in temperature means decrease in gait speed?
Yes.
Okay, thank you. So I get like my directions mixed
that's
up,
good.
so thanks.
It's really good you asked because it's a podcast, it's not only for us. So, with people with higher speed gait, it was more obvious that the hotter it gets, the slower they get.
Because they have
It's almost like they have reserve.
Got it.
And I'll get to it later. It's very interesting. The detrimental effect of increased temperature of chair rise time, how long it takes you to get up and down from a chair 5 times, it was seen in the total group and within both subgroups of older adults, but even more in the older adult with lower speed gait.
So it affected the worse off people more.
Yes.
Like chair rise.
Yeah. So just for example, from 14.0 seconds in the temperature category of lower than 22 Celsius, which is around 70 Fahrenheit, to 16.24 seconds in the temperature of more than 27.9. So it was more than 2 seconds difference.
Ooh, that's huge.
Yeah. So less than 8 Celsius degrees cause more than 2 seconds.
That could be the difference between saying someone is at risk for falls and someone's fine.
Yeah.
Wow. That's nuts.
Yeah. And it's all because of the temperature in the apartment. So
you home health people, maybe it might be worthwhile to take note of the temperature in the homes that you're in. I don't know if you do actually already.
they probably do, because me as a therapist, I would not like to treat in an environment that is not safe for me, also dehydration wise and respiratory wise.
Yeah.
Yeah. However, one last thing. Remember, there's another thing we didn't mention, the balance.
That's right.
Yeah.
Oh, man.
Yeah. However, the detrimental effect of an increase in temperature on balance was seen only in the subgroup of older adults with initially lower gait speed.
That's insane. So, like, the people with the higher gait speed almost had a protective effect with their balance.
Again, they were, another thing that I forgot to say about this article, it is open source.
Yes!
So you can see the graphs. There is actually a really nice graph about how the temperature affects every function to every population and subgroup.
That's cool.
So it did affect older adults with high speed gaits, but didn't affect them
as
significantly.
Much. Wow, that's really interesting.
Yeah. There is an effect on balance. Temperature does affect balance.
Interesting.
Yeah. A little bit of the discussion. Do you want to say anything about the results before?
I kind of find it surprising that it affects balance so much. I was expecting, like, the muscle power stuff.
You were expecting something that has to do with endurance or with something that is more labored.
Yeah, but, like, I mean, balance is complicated and all that, but I just wasn't really... I guess it's only because I personally haven't experienced or I haven't noticed any change in my ability to balance myself when a temperature changes. But then again, I've never had problems with that, so...
Also, you were never more than 6 years old.
You're right, I've never been more than 60 in my life. True.
Discussion. This study shows that high indoor temperature in an older adult's own home negatively affect their physical capacity. And the results here are kind of in line with the laboratory-based study, the other things I talked about that were in the lab and showed the endurance capacity.
But they show in a real-world setting.
It shows in a real-life setting and also on older adults and not only young athletes. And the effect were especially noticed in those older adults with limited speed.
Yeah. I think that was the part that I was the most surprised by.
So the effect was especially noticeable in those older adults with limited physical performance, with the lower gait speed, who also have worse medical conditions. We need not to forget that they have worse medical condition, and that might be the effect, especially on balance. That could be the effect. So walking speed was assessed as the habitual gait speed.
Yeah, not maximum.
What is comfortable for you to walk in? The balance and the 5-time sit to stand were as fast as you can, or as well as you can, as long as you can. But this one was walk in whatever comfortable speed. And as you can see, the people with the higher gait speed reduced more. It's because they had more reserve to reduce from.
Yeah.
The people that already walk slowly, which is, as we know, risky, cannot afford that reduction.
I see. So the people with the higher gait speed can give up more of their ability to thermoregulate.
Yeah, exactly. If I walk in the street and it's hot and my walking speed is pretty fast, I can allow myself to reduce it because it's hot and now it's good for me for my thermoregulatory functions.
I see. Whereas the slower, like, they're already going very slowly.
Yeah, it's all already dangerously slow. They cannot afford to lose more of that speed.
So they just suffer.
So they don't reduce it as much.
Interesting.
Yeah. A little bit about the criticism in the discussion, which I really appreciated, because it's something that I don't find in many studies. But here they said it loud and clear. The results of this study cannot be generalized, as this was a convenience sample, although they are in line with other studies, including large samples of older adults.
I like it.
And due to organizational reasons, the participants could not be visited at the same time of day.
Yeah, that was a criticism I had.
And the environmental aspects of the building, such as thermal isolation and shading, you cannot really test that.
Right, especially in a sample of convenience.
Yeah, and also they did not check for heat adaptive behaviors. Let's say that it is too hot here. is the older person initiating open the window. I really appreciate people that do home visits because a lot of times they are more perceptive. The environment in which they treat can tell a lot about their client, and they really pay attention to it. So I really appreciate it.
Good work, home healthers.
But this behavior was not assessed. Also, I like that study a lot also because I always feel that heat has an effect on our patient, and that the environment, whether it's a clinic or a home visit or the hospital, which I know the hospital environment is a little hard to control when it comes to temperature, but we need to try as hard as we can because it does affect our patients.
Yeah, and this could put them in a category that's inappropriate for their real abilities.
Yeah.
Interesting. Man, good article.
Thank you.
As usual. Excellent work.
Thank you. Anything you would like to say?
Yeah.
I also love that now I have the excuse to tell patients when they complain that it's too cold. They're like, oh no, it's good for you. It's around 25 Celsius.
It's better than the alternative.
Yes.
I like it. Well, thank you all for listening.
I'm Tali Spaceman.
I'm Erinn Carey.
And this is SRP Rex, Senior Rehab Podcast. And as always,
stay funky.
Hit me. Thank you for listening to the Senior Rehab Podcast. If you only listen to these podcast episodes, you are missing out on 90% of the Senior Rehab Project. Hop on over to seniorrehabproject.com where you can join the movement that's advancing care for older adults. You can join for free or become a part of the Game Changers where you can get some free gear and access to our monthly meetup. Just go to seniorrehabproject.com. I appreciate y'all, and I'll talk with you soon. But in the meantime, do not forget to stay funky.